I'm going to hand over now to Mellisa Stanton from the RCN, who's going to share what you need to know about working in the independent sector, and will tell us a little bit more about the RCN as well. Thanks, Mellisa.
Hi everyone. So as Jo has kindly introduced me, I'm here representing the RCN today to talk about the help and support that we have that we can offer here at the Royal College of Nursing. So the next slide that I'm going to talk to you about is about some of the settings that I have represented as an independent sector nurse. So a little bit about me. You know, my name's Mellisa. I'm an independent sector nurse. Throughout my journey, I've worn many hats, which have included working as a carer, then progressing through roles such as nurse, deputy manager, clinical lead, registered manager, and senior director. But I have to say that my heart has always been closely aligned and connected with the independent sector, particularly adult social care. Supporting dedicated teams and empowering people to deliver compassionate person-centred care has not only shaped me personally, but it's also shaped me professionally, and it's made the person that I am today. So I'm very proud, is what I'm saying, to represent social care settings. So I've been a registered nurse now for over 20 years, and my career spanned and began as a carer in a care home setting, banking that is, but I was discouraged really way back when from moving into my registered practice as a qualified nurse, because back then it was seen as the place to go to when people retire. And I didn't believe that, because I felt that there was a rich learning environment within a care home, and I'd experienced that as a carer. But needless to say, I did want to see kind of and have the experience of working within an NHS setting. So initially, I did what was called back then the D2 E grade development programme, and moved into an F grade as a sister within an acute NHS trust, which was a good grounding for me. However, I felt that there was something missing. So I moved across into independent sector settings, some of which are detailed within the slide that you can see there. And some of those settings represent all IHSE settings. So you'll see that care homes is there. And what I did was, I learnt more about the invaluable clinical skills that, although I touched upon within my career in an NHS setting, I didn't really get a chance to perfect the skill. So as Ashley referred to earlier, I developed skills such as bloods, complex wound care, tracheostomies, suprapubic catheter, vac pumps, syringe drivers, and a diverse kind of skill set that was available, that I was able to take the time and perfect, giving bloods, and that really made me kind of value the setting that I was in even more, in that it was a mini acute hospital environment, a clinical environment, but also the best of both worlds, where it was personalised. So there was very much pictured around the home, the feel of the people that were living in that environment. I was working within their home. And these IHSE environments, you know, they reflect varied settings. Again, I'll mention on the slide, but I think what I want to kind of demonstrate to you as students is that the world's your oyster. It isn't just about going somewhere because you have been signposted to go to that area. It's about being curious thinkers. It's about exploring alternative settings. It's about doing a week's unpaid, you know, work experience, perhaps as a newly registered nurse, as a volunteer, in just exploring the setting, living and breathing the environment that you work and potentially will work within, such as, for the benefit of today's call, adult social care. And what I'll say to you is I worked within adult social care, both within a care home and within individuals' homes as well. So I'm really proud to champion and represent all independent sector settings today. So moving on to the next slide about the Royal College of Nursing priorities in independent health and social care. So we are the world's largest nursing union and professional body, and as a lead nurse for Independent Health and Social Care North West and the Isle of Man, you know, we represent as an organisation some 500,000 nurses, midwives, nursing support workers, and around 20,000 independent sector members within the North West region alone. So what we're ensuring that we do through advocacy, education, professional development and workplace representation is to support you, our members, and people that perhaps aren't members equally, who can access some of our provision for professional documentation and CPD. So while many of you may associate the Royal College of Nursing with the NHS, I hope that you'd hear with the brief kind of conversation that I've initially had is the fact that we don't, we very much represent all sectors and settings, which is why within 2020 the RCN developed the Independent Health and Social Care Strategy, and 12 lead nurses who are subject experts, I am one of them, were onboarded to best amplify the voice of independent sector and social care nursing. So the RCN recognises, the executive team do, this value, and a strategy was implemented, and the big 5 priorities, which are detailed above, actually represent your value and the future voice of nursing. So in terms of thinking about your career on the next slide, it can be daunting. There's a wealth of opportunity that's out there. So as I've alluded to and have mentioned before, I think picking up the phone and having informal conversations about what you can offer, what you bring as a student, what you bring as a newly qualified nurse to their setting, as a former registered manager within a setting, and you know, I would be looking at what is this person bringing differently, who are they, who are they bringing to the team, and I would encourage you to focus on your own passions and experience, not just about nursing, but who you are. Because if you're looking to move within adult social care, it's what I was talking about before the power went was the role of the Royal College of Nursing as a professional body and trade union, and some of the support mechanisms that are out there to support you through your career journey into, hopefully, namely social care environments, but you need to experience to know what you like and what you don't like. So if you're a student nurse, newly qualified, or simply curious about a career in independent health and social care, what we can do is support you through the process in your growing field. So there's forums that you can join, and some of these are within the link of the slide deck that I've provided, which I'm happy to be shared with you. They talk about career pathways and opportunities. We have RCN Learn, which is a CPD platform that we have that is for non-members as well. So I'm talking to you both as members of the Royal College of Nursing and as future members of the Royal College of Nursing. It's invaluable. So all you need is an email address and a password, and these CPD credits and points can add to towards your supporting your revalidation when that time comes, but also giving you additional professional insight for your existing study or future study and career aspirations equally. You've got the nursing library, which we have physical libraries across the UK as well as online. I mentioned about getting involved with forums, so we've got a care home and social care network that you can join. We've got the Older People's Forum, we've got public health, we've got infection prevention and control. All of these, you will find people that represent social care settings making decisions and informing consultations that come from central government. So it's really important that we hear your voice, because all voices matter. You've got, as I said earlier, a dedicated lead nurse that represents the sector. We all come with our own specialist experience. So mine will be care homes, clinical education, an agency, but we've got people that have worked in the NMC, CQC, prisons, general practice. So we all complement one another to help you through your future journey and your existing journey. We pay attention to growth areas such as community-based long-term condition management and support for older adults. So there's increasing demand to have real representation of people that are working in social care settings at these tables for meaningful discussion, really. So what I'm saying is we're very much about your professional development at all stages of your career. So looking at your paths, looking at RCN Learn, looking at leadership skills. We've got our own leadership programs. Looking at the library, joining a forum, connecting with, you know, myself, or connecting with other people that are within the independent sector team. The next slide's about all the useful links that we've got here at the college. And it really is talking about additional key ways you can get involved. Now, as you can appreciate, in 10 minutes, I can't begin to tell you the wealth and the platform that the RCN has in support of you. But this is just a brief insight into things that I think are going to be suitable for you in aiding you and supporting you in deciding where it is you want to work. So you can link in with your local branch. So the North Western Isle of Man branch is based in Bolton. It's a great way to get connected with like-minded individuals. You can join the independent sector Facebook group that we've got, where we represent, you know, different people from different settings and share your ideas. If we get enough response, we put these forward for, you know, discussion for work streams to commence. I do engage with many students, heavily engaged at the moment, in all honesty, because I think you are the future of nursing and it's where our focus should be. There are lots of ways to influence the RCN through activism academies that have been created with the new institute. I've mentioned forums already, volunteering, activism roles. I can talk to you more separately, by the way, about each and everything that I'm mentioning today, and I'm happy to do so. But I think for me, whilst, you know, you're still on your student journey, albeit may well be the last leg of that journey, I think becoming a student ambassador with the RCN is a really great kind of mechanism for you to amplify your own voice and develop your own skills within the RCN, but, you know, as a person. We've got our EDI strategy. So we have a multicultural group, the Multicultural Network, which has got over 270 people that are active as, you know, both people that represent those communities, but also people that are allies, good, kind people, basically, as we are on this call. The next slide is just in following up from when I said, to me, if you're a member, great. If you're not a member, it's not that it doesn't matter. It's just, I just want to talk to you about the value, and I hope I have done in, you know, in the time that I've been given. Your membership will give you access to professional support and services, legal representation, continuing professional development, a voice at national policy, supporting workplace issues, peer networks and forums, which it can be really helpful when you're an independent sector nurse, because at times, I'm not going to lie, it can be isolating, but then you go and work in a community such as a care home and you've got this extended family, I describe as, and I can still remember the very first home I managed that really has left footprints on my heart, and which is why I'll always advocate and lobby for fair pay terms and conditions for the people that represent those settings, not just nurses, but the whole mechanism people. So the maintenance people, the catering staff, the wellbeing staff, everyone, it's so important. So for me, social care is on the map. I'm going to continue to amplify the voice of nursing within social care, and I need you to amplify that voice with me. So thank you for time today, and do you have any questions?
Thanks for that, Mellisa. I think in terms of questions, are you happy if anybody has any, that they put those in the chat and we cover those as part of the main Q&A? Fantastic. Thanks ever so much, and sorry about your ill-timed power cut.